one of the things that we are working on, and a few centers around the country, there's probably about a dozen centers around the country, are looking for ways to refine the technique of transanal excision. So many polyps and some tumors of the lower rectum in the past have required radical surgery and even a permanent colostomy to cure. Colostomy being an external appliance or bag that's worn on the abdominal wall into which your intestines empty. It's disfiguring and something that everybody wants to avoid. However, it can be life-saving. In order to avoid that, one of the techniques has always been to go through the rectum, to go through the anal opening, and to work inside the rectum to remove tumors and polyps. This obviously has some technical challenges and logistical issues with it. Now with the robot, we've applied robotic techniques to this where we can, with the patient fully anesthetized, insert an operating instrument through the rectum and work inside the rectum using very, very fine robotic techniques under 3D high-def visualization. Just seeing in that area can be very difficult, and we've been able to extend our ability to remove significant polyps and tumors that are higher up and were in the past where we were unable to reach and we needed to do abdominal surgery to get to, or even cancers that were very difficult to access. And we've been very successful at Reston Hospital Center doing this with the XI robot, which is the latest technology, robotic technology that really doesn't exist anywhere else in Northern Virginia, but it's being used around the country. And we've been applying this. I've been applying this to extend our ability to do these operations in a minimally invasive fashion and avoiding a colostomy in many cases. I've had a number of cases where the patient had been recommended to have radical surgery and a colostomy, and we were able to do this with that. It's basically incisionless, and the patient goes home usually the next day.